Abby Tedros here at the WBTV News Now desk, coming to you with an important conversation about head trauma. We've learned the cause of death after those shocking revelations surrounding the passing of Bob Saget. Authorities have concluded he died of blunt head trauma. He hit his head before he was found dead in his hotel room, and his family following up saying he likely thought nothing of this injury and went to sleep. Joining me now to talk about head trauma, we have Dr. Britton Christmas with Atrium Health. Dr. Christmas, it's great to have you here. I do want to start off by pointing out that the autopsy also showed that Bob Saget had COVID-19. So I want to ask you first if there's any possible link between testing positive for the virus and exacerbating possible head trauma.
It's extremely unlikely that there's any correlation between COVID-19 and the head trauma itself. We haven't seen the virus affect the outcomes from traumatic brain injuries or expansion of blood on the brain, if you will, in our experience.
It was so shocking to me to hear about not only the blunt force trauma, but he went to sleep thinking nothing of the injury, and it turned out to be a medical emergency. We know, according to authorities, that no one was there with Saget hours before his passing, so we don't really have the evidence to really zero in on his specific case. But walk me through how common it is, if it is common, for someone to suffer some sort of a head trauma and then think nothing of it.
Yes, and that's what makes it difficult. And in this case, we're not sure where he suffered the head trauma, but there's always a likelihood when we look around our homes. Bathrooms, for instance, are one of the most dangerous rooms in the house. Several hard surfaces, obstacles. And when we fall and suffer head trauma, the things to really watch for are things such as loss of consciousness, severe headaches, repeated nausea, vomiting, loss of short-term memory, slurred speech, seizures especially, any behavior changes, irritability, and those are some signs that this may be more than a simple bruise on the head.
How about the likelihood or how common it is for someone to have a medical emergency in their sleep?
Yes, and that is the difficult part with head trauma. Is one of the things that we have to watch out for is an altered mental status, somnolence, the patient not waking up easily. And this becomes difficult. In this case, it's likely that he hit his head, he was alone with no one to monitor him, and probably suffered an expansion of his injury during his sleep. And I think that's why it's very important for people who suffer head trauma is to really have that close monitoring with a family member, friend, someone that can really keep an eye on them for 24 hours, even if it's as simple as a concussion.
Such an important tip there, but also so unfortunate that he was out on the road for a tour in Florida in a hotel room, so he was by himself, according to those reports. I know that you outlined some of those symptoms to watch out for. Could you give some more insight into what you should look out for? Not every head bump is going to warrant a visit to the doctor, but when should you consider that?
You know, I think for us as physicians, when patients incur head trauma, the thing that is going to push us to get head CTs, to do a deeper workup, are going to be persistent headaches. And one of the common complaints is the most severe headache I've ever had in my life. Persistent vomiting, nausea after a head injury, age greater than 60, and patients that are on blood thinner medications. And as we know, this is a growing population in our group, or other patients that we can't get an adequate neurological exam on, such as alcohol, drug intoxication, anyone with seizures, or a mental status that does not quickly return back to baseline. And for those are the things that really give us heightened awareness to the potential for a brain bleed following a head trauma.
So in childhood, you remember your parents asking you to wear a helmet when you're riding your scooter, maybe your bicycle. Give us some insight into the fragility of the brain.
Yes, it's, we can't stress the importance of wearing helmets when riding bicycles, motorcycles, scooters, and the issue with the brain is it is a very tight compartment, if you will. So if you get bleeding within your cranial space, that expansion begins to put pressure on the brain and the brain tissue, which there's really nowhere for it to expand. And so the only place for that to expand is downward, which can lead to herniation of the brainstem. Unlike other areas of the body where we've all seen, bruises on our arms, legs, and you can actually see the swelling. Well, if you picture that happening inside your head, except there is nowhere to expand except for to put pressure on your brain.
All right, Dr. Christmas, thank you so much. Is there anything else that you'd like to add?
No, thank you. Thank you very much for your time today.